Hello, everybody, and welcome to this episode of ADSA Student-Led Education Series. I am Demi-Lee. I am your Education Officer for 2025, and today I bring you the first episode of the year. Our topic is advice on how to excel academically and clinically in dental school, and I have with me three of my good friends who are fellow final year Griffith University dental students, who I think are very, very good people to speak on this topic. So I have Kaamini, Xian, and Kiera joining us today. Awesome. So it's going to be a nice chatty episode. So make yourself comfortable, grab a snack, and without further ado, we're going to jump straight into those tips and tricks. So my first tip and trick is to create tangible and realistic goals. So what this means is that your goals should be something that you can break down and write down. So whether that's digitally or on a piece of paper, whatever you prefer, you should be able to break your goals down into bite-sized chunks. I think this makes them more easily achievable, and this can apply for not only dental school, but other aspects of your life as well. There's, so many studies that show if you are able to actually write your goals down, you're so much more likely to achieve them. It's something I've pretty much been doing since the start of dent school, and I just love it. I think it's the way to go. I do it at the start of the year, but I also keep in mind that my goals can ebb and flow and change throughout the year. So you might start out with a particular goal in mind and find that okay, this isn't actually the route that I want to go down. Or equally, you might find that you fall into something else and then you add that new goal to your list. So I love doing that. Do you guys personally write down your goals?
I personally prefer to type mine on my notes app on my phone so that I have it with me wherever I go and I can refer back to it whenever I'm out. If I check something off while I'm out, I can check it off on my phone. It makes it nice and easy.
Yeah. I think it's just so good when you can break it down and wherever you have it and however you have it, it's just so satisfying when you can tick things off as you go and just it makes you feel good. So that's my first tip advice. And don't try and take on too much at once. I think we're all really naturally ambitious people. That's why we're in dental school, and that's probably why you're watching this video on how to be better in dental school. But try not to take on too much at once. Focus on a few goals that really mean something to you, and you can always add new ones as you go.
So, tip number 2 is to make friends and form study groups. So, this is something that I think all four of us definitely found very helpful in first year. My recommendation would to be to go to as many social events as you can in first year and just familiarize yourself with everyone that's in your cohort, make some really good friendships. And then once you've got those friendships formed, it's great to hang outside of uni, but also when you're at uni to form those study groups and quiz each other and just make sure you're all on the same page with content and things like that. And it's really good to just have people that relate to what you're going through and can relate to your experience. It makes studying and just going through uni life in general just so much easier.
Absolutely. I do agree with that, Kiera. Um, it's really hard sometimes for your friends outside of dental school to kind of understand some of the struggles you're going through. And having a solid friend group in dentistry kind of helps keep you motivated, keeps you on task. And as we've said on the slide here, forming study groups, discussions are a really great way to kind of expand your knowledge a bit more and lock down your understanding of basic concepts as opposed to just kind of rote learning them alone by yourself.
Yeah, absolutely.
Awesome, guys. So we're going to move on to tip number 3. So we said not to just rely on your lecture slides. Now, your lecture slides are sort of the bare minimum. They give you a broad sort of idea of what you're expected to know, but your learning really doesn't just end there. It isn't really spoken about enough, I guess, but supervisors will ask you questions that go beyond just your lecture slides. So definitely make it a habit to do the readings that might be attached with your lecture slides. Textbooks are a great place. If not, journal articles, I think we've used plenty of. Maybe not so much in our first years of our degree, but as you move through into third, fourth, and fifth year, where the content becomes a little bit more specialized, journal articles are great because the literature can be changing. So materials are not exactly the same. Things that they said in our lecture slides about 10 years ago might have changed. So it's great to just be up to date on what the current protocols are. So um, take it upon yourself, I guess, to just do that further research. I know even in terms of clinical procedures, I use things like YouTube to look up videos on how to do things and steps that, sometimes just reading it might not be useful, but use those resources that you can find online. Dental podcasts are also great. It's great to hear other people speak about their experiences, which you might not get from a lecture slide. So just use those other resources that you can get besides just your lectures.
Yeah. Yeah. Absolutely. I think you've really covered it all there, but I am a big fan of dental podcasts. I'm listening to them all the time while I'm driving. And, even old school textbooks, I mean, you can get them digitally now as well, but just expanding upon those concepts a little bit. I feel like your lecture slides are great, but they are pretty surface level. So kind of going deeper with your level of understanding can be really good as well. And it will impress your supervisors too.
So tip number 4 is read the clown book. Now, this is a little free therapeutic guideline booklet that the ADA gives you as a student. And a lot of people dismissed it in first year, but it actually comes in so handy for when you start seeing your patients in third year. Especially if your patients are on certain medications. The clown book kind of tells you what kind of things you need to think about to practice safely. And it's really good to kind of start early with your reading through this because it's quite a chunky book. And familiarizing yourself with it early will pay off a lot more in the long run because some of the tips and protocols mentioned in that book might also come up in your vivas come fifth year.
Yeah, I think especially when you get into your clinical years, so maybe third, fourth, and fifth year, I think all of us here have maybe been questioned by our supervisors on things like antibiotics prescribing, what kind of pain medication you would give, and you really need to be answering according to the therapeutic guidelines. So this is sort of our holy grail. I know all of us sort of reach for it.
Yeah, absolutely. I think we have the physical copies, but now there's the online version that you can get as well, and you should be able to gain access through your institution. And there's also a mobile app too, so that's super handy to just have on you at all times. Even if you're bored and you have a few minutes, you can just quickly scroll and find something, or, I know it's kind of saved people in clinic where they've just wanted to quickly double check something and then it's just been in their pocket. So I think that's a really great resource and an essential one, of course. Yeah. Next tip, this is probably my favorite tip personally, is not to skip over words or concepts that you don't understand. I think it's so easy to do this because when we don't know something, our brain just naturally skips over it. But what I've started to try and implement for myself over the last few years is every time I'm watching a lecture or reading something and I find a word that I don't know, I'll just quickly jot it down on a little notepad. And then later, when I have the time, I'll go back and really deep dive and find out what it is. I think doing it this way, and whether you want to write it down or, type it up on a glossary list or something like that, it doesn't interrupt the flow of what you're doing, so your study, but it makes sure that your study is comprehensive and you're not missing anything. Yeah, it's really worked so well for me, and they tend to stick when you do, just, find a couple hours at some stage in the semester and you might have a list of 20 or 30 things that you want to go over, and it's actually really fun. You'll probably find some things that really interest you as you do that too.
Yeah, I definitely agree with what Demi said there. I think it is also important to try and identify the key terms in the lectures and the content that you're given. Something that I like to do is with the key terms, I'll put them into a table and then put the definition beside, even if the lecture doesn't necessarily have a definition or it's just a random word that you think is still quite key. I like to put it in the table and have that table at the front of that topic so that I can always refer back to it later.
Yeah, definitely. And I think doing that, it sticks in the end. Even that process of just writing it down or putting it somewhere, at least for me, doing that, I always remember it. Yeah.
Right, our next tip is to forget about cramming. It can get really stressful when you have multiple subjects you're trying to study close to your exam season. So we would definitely encourage trying to come up with a study routine where you're sort of progressively learning the information. That spaced repetition is very important in dental school. Not everything you learn is counted, like sort of just comes naturally. So I think having that repetition over a few weeks or even months helps a lot when you get to that exam season. I know a lot of us started our study groups a little bit earlier in fourth year because we learned in third year you can't cram everything. So we learned from our mistakes. So take it from us that you definitely want to start early. You'll never regret it. And try to come up with tips that sort of facilitate your understanding rather than sort of just like trying to commit it to memory. That's really important as well, I think. And it'll help with that long-term retention when you get to that exam season time.
Yeah. And I think that's so important, right? I mean, ultimately, the goal is to be able to apply all of these concepts that we learn clinically. So the point is not to pass an exam or do well on an exam. Of course, though, we all want to do that, but it's to be able to recall that important information as we're seeing our patients. So I love that tip. And it's hard to do, easier said than done.
So, tip number 7 is to embrace change in terms of study techniques and hand skills. So, essentially, what I mean by this is you may come into uni from high school having some techniques that you think um, may work for school, but I think when you get to university, you'll find study techniques might need to change a little bit just because the sheer amount of content that you get. So I think just being adaptable with your study methods and maybe in the first few years trying something new and just seeing if there's perhaps a better study method out there that works for you. Um, and also, same thing with the hand skills. When you get into the sim clinic, I think Kaamini mentioned before that watching YouTube videos and that kind of thing really helps with visualizing the technique that you're having to use in SimLab. So I think just being really open to trying new things and as hard as it can be sometimes, definitely try not to compare yourself to your peers. It's all about team effort and helping each other out. But just make sure you're being really open-minded about how you're studying and the kind of techniques that you're applying.
Absolutely. I'll just touch a bit more on the hand skills side there. I guess from my experience coming through like the sim lab and then into clinic, there's many different ways to do something in dentistry. And what necessarily works for a lot of other people may not work for you. And it also can be quite case dependent. So you might be doing class fives a certain way for every single patient, but one will come along where that technique doesn't quite cut it. And it's always good to kind of broaden your hand skills and try new things so you have a technique to fall back on when things don't quite go to plan in clinic.
I think just to sort of resonate of what Kiera and Xian said, that really applies even in your sim lab days. So try to practice that in sim lab when you get in second or first year because it'll prep you for clinic. I know in sim lab, my biggest regret was being so type A about all my procedures. If something didn't work, I would just keep trying it until it would work and it just wouldn't work. So
Yeah.
take it from me. If it doesn't work, go to your friends, go to your tutors, be like, this technique isn't working for me. Can you tell me what I could try? I know I went to so many of my friends and they were doing it completely different. So don't get stuck on doing something the same way. Try something different if it doesn't work out.
Yeah, absolutely. I think we both did that, Kaamini, and just watching the way other people would do things. Sometimes it's a way that you've never even thought of doing it before, and you see it and think, oh my gosh, why have I not been doing that the whole time? So I think this is maybe the most valuable tip of all, and it's so true. Even we changed throughout dental school as well, you know. I started out and I used to hand type all of my notes for every single subject. And as I kind of progressed throughout the degree, I've come to realize that this is not the most effective study method for me. And I've kind of switched to doing a few different ones. So I love this. I think it's so important. We're all very type A, but it's kind of shifting out of that mindset, I suppose, being more open.
Right, so tip 8 is know your procedures ahead of time. So when you're in the clinic, it's usually one supervisor looking after a bunch of different people. It's a lot more efficient for yourself and the supervisor just to kind of familiarize yourself with what you're planning to do for that session. So looking ahead of the clinical notes, having a rough idea of what the patient's coming in for, if you're able to glean that information from their last visit, what things you might do, what things you might need to get, and having that all set up and a bit beforehand. If it's going to be your first endo or your first resto, just talking through the steps, just so you feel a bit more comfortable. And when you're in the session, you kind of have a bit more of a clear head because you prepped everything beforehand. You can kind of just do it instead of kind of panicking, what should I do next? What kind of things I've forgotten? Having that preparation will really kind of make you focus a little bit more on the experience you're having in the chair.
Yeah, I think that definitely applies to SimLab as well. Particularly at Griffith, SimLab is the time there is quite short, so you definitely want to utilize that time as much as you can. So definitely make sure if you have access to the procedures and the tasks that you'll be doing the following day, definitely just try and have a read the night before, and you'll find when you go into SimLab and you're actually doing that task or procedure for the first time, you'll be so much less stressed.
Yeah. And I suppose even in addition to that, just knowing exactly what materials you plan to use, but then also having a backup option as well. If for whatever reason I can't use this material, what can I use instead? And I suppose understanding why too, which links back to our previous tip of not cramming and actually understanding your content. So yeah, I think ultimately these all kind of tie in together and will make you a more well-rounded theoretical and clinician. So I think it's so important. My next tip, this is a bit of a Gen Z style tip, but you can research hacks and tricks on YouTube, TikTok, Instagram Reels. I mean, there's so many, like people have so many efficient little ways to do things, and not all of them might be the most well researched, but if they're safe and your supervisor's happy, you can always give them a go and see if they work for you. What works in your hands might not necessarily work in somebody else's hand, but I think it's just so worth trying out. And yeah, the one I've got up here, I haven't given it a go myself personally, but it looks really interesting. So I don't know, maybe I'll have to give it a go at some stage for my alginate. But I would say also this just ties into, watching other people and learning from other people too, which I think we will touch on in a future tip as well. Yeah.
So tip number 10 is working as a dental assistant. So for me personally, I've worked as a dental assistant the whole way through dental school, and I think it has definitely served me well, especially in first year. Just in first year, it's very, very overwhelming with all these new terms and all these new, like the anatomy and everything like that. It's really, really helpful having worked as a dental assistant prior, just so at least the terms are familiar to you and you're not hearing them for the first time in that lecture. I think as well it's really helpful just getting an idea of what the day-to-day workflow is like in a dental clinic, and just knowing what materials you need, or even just knowing what the dentist needs as well while you're assisting them. So yeah, definitely a very helpful tip.
Just to add to, think what Kiera has said as well, I think if you work as a dental assistant, you get to experience something that you don't really see in dental school, which is like the sterilization part of how a clinic works, and even reception. You don't really get the full picture of it when you work in such a big institute like a university, but at a dental clinic, you'll sort of see a lot of what you'll be exposed to on your day-to-day on the job. So steri is a really big part of your work. Infection control is really important. And I know that was something that was really useful when I got my first dental assisting job as well.
Yeah, definitely. And I think in addition to that too, you see a wider kind of demographic and variety of patients as well. In dental school settings, you do tend to see more older patients, and that's fine, but you want as much experience as you can with different type of people, and also probably a wider range of procedures than you might necessarily see at dental schools too. So your exposure is just so much more if you can work privately as well. And I think this ties in really nicely to our next tip. If you can't work as a dental assistant, you can always shadow as well.
Yeah, definitely agree with Demi. So shadowing is something I think I wish I would have done a little bit sooner in my dental degree. It's a great way for you to sort of meet dentists that, are willing to mentor and guide students through transitioning from dental school into the private world. And I think it's a great way to also see how a practice runs their day-to-day operations, which is so different to university. Now, my advice, if you're planning to shadow a dentist, a great time to do it is during your uni breaks, either the mid-tri or mid-semester breaks, or your end of summer break, which is pretty long. You can reach out to the dentist. I have done it via emailing and also through LinkedIn, but I know friends who've done it via messaging on Instagram. Just be professional, be nice, be warm in your email and your approach. Tell them you're interested in coming in to shadow if they're willing to have you. And if they have a particular sort of equipment that you're interested in, for example, if they have a CEREC, so CERECs are your same day crowns that some clinics might have, you can even mention that in the email. I'm really interested in seeing the workflow of how a CEREC appointment works in your clinic, and they'll normally get you to come in on a day where patients booked in for that particular procedure. And then on the day, you want to make sure you arrive a little bit early, introduce yourself to the dentist and the staff, tell them you're a student, tell them you're here to learn, and bring a notepad if you can. Just take some notes wherever you can. Come up with questions if you need. Most dentists are really lovely. They're very welcoming, and they know the struggles of going through dental school, so I feel like they can really relate to us. So you almost feel safe in asking them questions. So I think that was a very valuable experience that I really recommend to anyone maybe in their later years of dental school.
Yeah, absolutely. And as you said, if there's a particular aspect of dentistry you're interested in, shadowing there, but I would say just general practice as well. If you don't have that experience as a DA, it's so worthwhile. And I would say shadowing a variety of clinicians too, because everyone has such a different approach when it comes to their workflows, how they make things more efficient. Are they doing four-handed dentistry and things like that? And I would say, importantly, their communication as well. Every single dentist I've either worked with or shadowed has approached communication in such a different and unique way. And I always just take away little snippets from every person that I work with. And as you mentioned, I always bring a notepad and I'm always writing down those just golden nuggets of great information. And I always end up applying it clinically and it works well for me. So I would definitely recommend doing this. There's so much to be learned. And as you said, people are so willing to help you out too. So it can seem a bit scary and intimidating to do, but one day you might be in their shoes and you'll probably be very willing to help people out. So couldn't recommend that enough. Yeah.
All right, so tip 12 is to check your patient's file beforehand and pre-fill your notes. So I did touch on this a little bit earlier, but just being aware of what your patient's coming in for, their medical history especially, a lot of supervisors like to kind of quiz you, especially if they know that they have something like a heart stent, they're taking a blood thinner, they kind of want to see that that you're across what they're taking and what its clinical implications are. And also pre-filling your notes saves a lot of time trying to one supervisor for all those students. A lot of supervisors like to read your notes beforehand, and that can also hold up the line a bit. It's also good practice to try and be thorough with your notes. Clinical note keeping is such a big part of dentistry, not just in dental school, but also when we graduate. It's kind of a legal obligation there. So getting to that good habit while you're in dental school now, making sure you're writing down all the key things, your diagnosis, what you did, what you used, is very important to start early so you can carry that through your career.
I just have more of a specific tip as like a subcategory to this one, just in relation to checking the patient's file beforehand. Xian said it was really important to check, particularly medical history. I think definitely make sure if there's things on that medical history that you think are quite significant, just making sure that you're going back and checking the therapeutic guidelines. So that clown book that we were talking about before, just make sure you know exactly what is written in that book in relation to that medical condition or medication that the patient's taking, because at the end of the day, that's what you'll be held to, because it's a therapeutic guideline. So yeah, just be really mindful of that.
Excellent point, Kiera.
Yeah. And I think that's why just kind of trying to get on top of these things early in your dental school career and studying consistently just ties so nicely into this, because even if you do all these things, your patient might present and they might have something that you didn't necessarily anticipate. Perhaps they're taking a new medication. So if you've at least somewhat familiarized yourself with everything beforehand, you're not going to be completely caught out. And if you have the TGA on you, you're not going to be caught out. So doing all of these things, it will make you more efficient, it'll make you safer, more well-rounded. So Absolutely. I think this is so important. And we don't want to waste our time in clinic either, So you want to be as efficient as you can, and having good notes templates, could not recommend that highly enough. It takes a bit of time, just do it at the start of the year or when you're starting out in clinic, but you will be so thankful in the long run, for sure. And I think this is our last tip, you guys. A very important one again as well. It's something that I think can be hard to do. You start out and everyone wants to be great, everyone wants to be perfect, but self-reflection is so important. Especially when you're starting out, your work needs a lot of improvement. Of course, you're still learning, but you're going to get some feedback from your supervisor. You might get some feedback from your clinic partner or whoever it is you're working with. But I think self-reflection is really, really key. It's something that I do pretty much every single day after I see patients, and not necessarily for every patient of every day, but at least for things that stick out to me. And usually I feel like we know what we could have done better before our supervisor comes over and gives us feedback. Or, when you discharge a patient, you're thinking, oh, okay, that contour could have been better, or, my sutures could have been a little bit tighter, or whatever it may be. But I think it's so valuable because if you know what you've done wrong, you can then think of ways to improve and better yourself. So definitely, I mean, it's hard, no one wants to feel as though they didn't do the best job for their patient, but ultimately just being kind to yourself and remembering that you are still a student, you are still learning. So it's absolutely fine to have areas for improvement. And I suppose also just taking that feedback well and actively seeking it. Sometimes you might not get it without asking. So I think the way I've worded it in here, instead of asking, what did I do wrong? Just could you tell me one thing that I could do better? And I think people feel a little bit less mean when you ask it that way. So they're more willing to give you advice. Yeah, I feel like this is something we all do. We all have similar kind of approach to this thing, but this is our last tip. So if you guys have any kind of passing advice for the kids watching at home, now's the time to pop it in.
Just enjoy the
It's,
journey.
that's
Yeah.
it.
It
Have
goes by
fun.
so quickly.
Make good friends, have fun, enjoy it. Yeah, I
Don't be
think we're
too
feeling that.
don't
Sorry
be
to
too
Kurt.
hard on yourself.
Yeah, I
Definitely
think we're
be kind
feeling
to
it
yourself.
being in our last year. It's gone by so quickly. When you're going through it, it feels really long, but once you're in fifth year, it's sort of like, okay, we've only got a few more months to go, so just enjoy
Yeah.
it.
Yeah, absolutely. I couldn't agree more. Well, thank you so much, guys, for taking the time today. I think this has been so valuable for everyone watching. So I appreciate you all so much. And for everyone watching, I will catch you in the next episode. Bye.
Bye.